Eyewitness News and other Hubbard Broadcasting TV and radio stations across Minnesota are helping those impacted by Hurricane Helene in Milton.
So we're raising money to support an organization called Direct Relief. It's a nonprofit working on the ground to provide emergency medical relief and disaster assistance across the Southeast. And joining us now this morning via Zoom is the president of corporate engagement at Direct Relief, Tom Rohn, joins us this morning from Florida. Hi, Tom.
Hi, Chris Steinbecken.
Hi.
So you were out and about, you were surveying damage over the weekend. Tell us where you were and what you were seeing.
We were in Spanish Lake, so it's near Fort Pierce, Florida, which is about an hour and a half south of our office here in Jacksonville. And it was incredible. I mean, this community of, essentially it's a mobile home community with seniors, and you had hundreds of mobile homes that were just destroyed, absolutely affected by the hurricane. And tornadoes had come in, and that's really what did so much of the damage there. And there were even some that all you saw was the foundation. They were, just totally gone. And the community had at least 8 people that were deceased, from this situation, but with likelihood of many, many more that may not have survived, just that they don't know. People tended not to evacuate because of the situation there, because the hurricane wasn't expected to be as strong, but those tornado winds came in and they just decimated that whole community around Fort Pierce and Spanish Lakes in particular. So we provided a lot of the emergency medical backpacks to the first responders there that were going from door to door, to kind of check out the situation at each individual home.
And we know other parts of Florida, it's the flooding that they're dealing with. You guys are also helping folks in the Carolinas, where even this morning on the news, we reported some folks still don't have clean drinking water, and it's been several weeks, and it could be several more weeks before they get that. So you guys aren't just focusing in one particular area. Your resources are spread out across the Southeast.
They are. We've had a whole team in North Carolina, too, and in Florida, really nonstop since Hurricane Helene hit and then Hurricane Milton. And when you have things like storm surge and flooding and strong winds, you also are going to have loss of electricity. So you have a lot of vulnerable individuals that have gone to shelters, or in the case of some of these North Carolina communities, have been just totally cut off. And we're working very closely with the federally qualified health centers, with the free clinics, with community pharmacies, and with the emergency operations centers in different counties in those affected areas to provide them with the different resources. In some cases, it's pharmaceuticals. In other cases, it could be like personal hygiene kits, or even the emergency medical backpacks when they're doing the different search and rescue, for looking for individuals that may still be trapped essentially there.
So Tom, tell us a little bit specifically about Direct Relief and, what kind of aid are you providing to people? Who's doing this? I think people really want to know if they donate, where their money's going.
Sure. So we're a support organization. We support federally qualified health centers and free clinics, and by definition, they're treating underserved and uninsured Americans, 32 million, day in and day out. And we have been supporting them for over 20 years, really since Hurricane Katrina. And so the aid that we're providing is just like we were doing before the hurricane struck. We were supporting kind of those vulnerable communities. By definition, they tend to be located in marginalized areas, in very low income areas. And so we're supporting a lot of those populations that wouldn't have a car to maybe leave ahead of time, or taking the bus and all. So a lot of these communities, and we'll continue to support them. I mean, you have a lot of displaced people, you have people that have lost their homes, and we're all medical focused on the work that we do. And so we'll continue to support those clinics that will be treating these patients and providing medical services to them. So we provide all kinds of things like, insulin and chronic disease medicines, because a lot of times in a disaster emergency situation, even if they're able to evacuate and go to the shelters, often people don't have access to their doctors. They don't have access to their medicines. And so we provide those 100% free of charge to patients that are, at risk and in these situations, or just everyday vulnerable patients and lower income patients in the United States.
Tom, as you and your team sit around and talk about, how you provide this help, as you look down the road, I mean, where are you a month from now? Where are you 6 months from now? Where are you a year from now as far as the needs and the help that you're able to provide to the Southeast and these folks who are suffering?
Yeah, we'll continue to support them. I mean, all of the funds that we receive in direct relief, it's not our money, it's for these communities. People are giving it specifically for these communities that have been affected by Hurricane Helene and Hurricane Milton. And so we will continue to support those communities, support their healthcare needs. A lot of work that we've done too is around building resiliency in those centers that are treating these patients day in and day out, helping them from everything from generators to resilient energy. With a number of the different clinics, we've come in and provided funding so that they could get solar panels and backup batteries, which helps the clinic, which are really just operating on a shoestring anyway, to be able to not have to pay that electric bill for the next 20 to 30 years. But more importantly, when the next big storm comes in, they can stay operating. Because in the United States, you can't operate unless you have electronic medical records by federal law. So by having electricity, they'll be able to continue to see patients, continue to have the lights on, and save, proactively, like often hundreds of thousands of dollars worth of insulin and vaccines and things like that. Whereas when they lose electricity, a lot of these clinics, unfortunately, lose those vital medicines and vaccines. So, I mean, that's another way that we'll be able to continue not only to support them right now, but continue to support their resiliency going forward. And we've already done this with over 50 clinics in Florida, in Puerto Rico, and in Louisiana, throughout those kind of areas that are vulnerable for hurricanes, as well as in California and in the Pacific West there around the wildfires, which is, kind of a different situation, but very similar in nature, where it can make these clinics that support underserved patients and vulnerable to disasters, our goal is to make them more resilient.
Well, Tom, we appreciate your time, and we appreciate your organization's efforts to help these folks, because we know the need is definitely great right now. So thanks again, Tom. And you folks at home, to join in the relief efforts for Hurricanes Helene and Milton, head to kstp.com or click the window on your app